What is prenatal counseling? What do you mean by prenatal? Hello, I am Dr. Aditi Godbole, consultant obstetrician and gynecologist practicing in Thane. Prenatal means before you give birth. So ideally, prenatal counseling starts with your preconceptional counseling. Preconceptional counseling takes care of all the things you should know before you become pregnant. And then, once your pregnancy test comes positive, and for us, when the beta HCG is above in the pregnancy range, then the actual prenatal counseling starts or consultation starts. The first visit is in the first trimester. Now, what are the trimesters? In the pregnancy, your whole pregnancy, we have divided into 3 trimesters. The first trimester is from the conception till the 12 weeks of gestation. Then from 12 weeks to 28 weeks, that is till 7 months. And the third trimester is from 7 months till you deliver. Now, when your pregnancy test comes positive and you visit your gynaec, there are so many questions in your mind. So now what next? The first and foremost things is there are few blood tests which we have to make sure that are done during the pregnancy's first trimester. It includes your CBC, urine routine, your thyroid, your basic diabetic profile, that is HbA1c, your fasting and postprandial sugars, and your HB electrophoresis, your blood group. And we have to make sure that if you have any pre-medical conditions, the gynaec should know about it and the medicine should be adjusted according to your blood test. Then the one most important thing, your gynaec will tell you to do your viability scan. What is the viability scan? Is they check whether your baby has developed till 6 to 7 weeks of gestation and has got the heartbeat. Viability means baby can survive till the life. The second step which comes in your prenatal visit is your NT scan. Your NT scan is usually planned between 11.5 weeks to 13.5 weeks. And it is actually a first trimester screening to see whether your baby has any genetic abnormality or not. During your NT scan and after your NT scan, they see some soft markers and they combine it with some blood test called as double marker to see if the baby is at the risk of developing any genetic abnormalities. The next important step which comes into your pregnancy is your anomaly scan, that is your targeted anomaly scan, which is usually planned after 18 weeks until 20 weeks of gestation. In that, the radiologist will make sure that all the parts of your body from top to toe are developed properly. After your anomaly scan comes an important stage where your gynaec will test you for the gestational diabetes, that is either GCT or GTT, and according to the values you will be treated. With your GCT and GTT, in second trimester, your CBC and your thyroid profile will be also repeated because usually pregnancy gives any female the hypothyroid effect. If your blood group is Rh negative, in that case, your gynaec will advise you to do one test called as ICT, indirect Coombs test. Accordingly, if it is negative, we have to plan to give you the anti-D injection in the second trimester. Also, your growth scan, that is whether your baby is growing according to the gestational age, whether the liquor is adequate, whether the placenta has developed properly or not, has to be checked around 28 weeks. Your baby will attain approximately 1 kg till you become 28 weeks. Now, in your third trimester, usually your iron, calcium and your folic acid with DHA, which has been started by your gynaec in the second trimester, that is after your NT scan, will be continued, and you will be called every 15-day visit with your gynaec. The last scan which is required in your pregnancy is a color Doppler and a growth scan. So in that, we will see what is the baby's position, whether baby's head has come down to facilitate the normal delivery, what is the liquor amount, whether it is adequate for you to go in labor, what is the placental functions, and also color Doppler means we will see whether the blood supply going towards your baby is adequate or not. And we will have an estimate of your baby's estimated fetal weight, that is the weight at the time of delivery. Also in your third trimester, your CBC and your viral markers, which are also done in your first trimester, will be repeated again, and your gynaec, once you attend the term of your pregnancy, will assess your pelvis, whether pelvis is adequate to deliver a healthy child normally or not, will be assessed by your gynaec. And further instructions regarding the symptoms of delivery, labor pain, leaking will be explained to you. Your gynaec becomes your companion during your prenatal visit till 9 months of gestation and is your companion during your labor and your delivery process. So never miss a visit with your gynaec. Always ask your doubts to your gynaec, and even if you feel it is stupid to ask few doubts, please make sure that you ask your gynaec the questions which are coming into your mind rather than googling it, because your gynaec is your ultimate guide during your pregnancy and delivery. Thank you so much.